for enemas, we're gonna practice with the big bag. This would be like for tap water enema or soap suds enema. Do any of you work at Hayes Med as a PCT? Yes, no, okay. They do one there called milk and molasses, where they literally pour milk and molasses syrup and mix it up and give that as an enema. So the sugars and things and the fats and the milk and things go in and help soften and help evacuate that bowel. This is what we're gonna practice with. But I did wanna talk about the commercially prepared ones. A lot of times people use these at home. We may use them in healthcare too. And I just do a quick demo with this because the things you wanna keep in mind, this has a pretty short tip. So, you know, it's only like 1.5 inches. That's gonna go all the way in on your person. These come pre-lubed, but please add extra lube because it's not very much lube. So be nice and give your person more lube. The thing with these, when you put it in, and I'm just gonna pretend this is my patient, you wanna kind of squeeze the end and you're gonna kind of roll as you squeeze, okay? The big thing is you want to not let go. You don't wanna just like squeeze like this and let go because then it brings bubbles and other stuff back into your solution. And then you've got air that you could be squeezing in. So you're just gonna kind of roll these as you squeeze it in until you get down to the end. And you can just squeeze that last little bit in. And then I keep it squeezed as I pull it out, and then you just throw that away, okay? So these are just the commercially prepared ones. We may use these, people can do these at home, but I just bring that one out just to show you guys. So, we're gonna do our enemas like you may do them for checkoffs or you may do them with your patients. I'm gonna bring a washcloth or wipes because I may wanna clean up when I'm done. I'm gonna bring blue pads or bed pads, whatever we've got. But I always tell my group, if you think your patient may not be able to hold it and get onto a bedpan or bedside commode, bring lots of pads with you. Because you may want to just pad the whole bed. That way if they go, and all you have to do is clean them up. So bring plenty of pads to protect your bed. So I'm gonna bring a couple extras. I'm gonna need lube. And I'm gonna need my enema kit. They'll come in a box like this. And these actually come with a soap packet that kind of looks like your lube packet. So when you fill this up with water, then you just put the soap in with it, mix it up to give them a soap suds enema. Or your doctor may just order tap water. So if it's tap water, it's just gonna be warm, lukewarm water. We don't want it too hot or too cold because we don't want to cause any injury or discomfort. And we're just gonna make sure we know what our doctor has ordered. I'll come back over here in the middle. And we're gonna go in, just like we did before, we're gonna explain to our patient what we're gonna be doing. We're gonna introduce ourselves, make sure we've got name, date of birth, and allergies, do our hand hygiene, get our gloves on. And while I'm explaining everything to them, of course they would have, hopefully, have a sink and bathroom in their room. We're gonna go over here to our sink real quick because I'm gonna get this ready. We're gonna fill it up. If we give you this for checkoff, she'll have an order. It'll say tap water enema, 500 cc's. That way you know exactly how much to get ready. When you unroll these, you'll see there's little marks on your bag. So like here's 500 cc's, here's 1,000, here's 1,500. And you would fill it up just to whatever has been ordered for that person. So I'm gonna say my order says 500 cc's, so I'm gonna fill it up. And another thing we wanna do is we wanna make sure when we fill it up that it's clamped. It's a little slide clamp. And then after we fill it up, while I'm still at the sink, I'm gonna unclamp it and kind of prime my tubing. That way it's not full of air, but it's more full of fluid, so we're not giving them a lot of air. So I'm gonna go over here and get this ready. These open at the top, kind of like a little Ziploc baggie. It's just got a little snaps open and close, and when you close it, you want to make sure it snaps, but be very careful. I wouldn't lay it down flat too long because sometimes these will pop back open. They're not always the most dependable closures. So we're gonna go over here to the sink. gonna fill it up to 500 cc's, and it takes this water a while to get warm, so we'll say it's warm. Okay. I'm gonna clamp this closed. Set that down, and I'm going to open my tube. And I can lift this up a little bit. Okay. So, got that primed. There may still be a few air bubbles in there, but it's not a whole tube full of air. Plus, I also have a really kinky tube right now. So I'm gonna come back over here, and while I'm getting my patient positioned and ready, I'm just gonna hang this on their IV pole. Okay, so, Christina, since you kind of helped me with this a little bit the other day, will you be my partner while I turn? So we're going to uncover, keep him covered as much as possible. He has a Foley, so we wanna make sure that goes with us. So I'm just gonna put that on the bed so we don't pull that out as we turn him. So we're gonna kind of pull him towards me, and then we'll turn him towards you a little bit, okay? 1, 2, 3. That way he's not smushed into the side rail. And we're gonna turn him on that left side as far over as we can get him. That way, everything's going the direction of that rectum and the colon. Because when they're like this, and we insert that tube in his rectum, we're going the same direction of his anatomy. So the fluid's gonna go in, and it's just gonna follow, and it's gonna fill into that large intestine. So we've got him positioned. I'm gonna put my extra pads down. I'm gonna make sure I have either my bedpan or my bedside commode ready, because we're gonna say he's pretty weak. He's not gonna be able to make it to the bathroom in time. I'm gonna lube my catheter. You can just put it on there. You can stick the catheter in the packet. Lube a couple inches of it. I'm gonna bring this over here. I'm gonna set it down on the bed, but I'm gonna have Christina kind of hold on to it, because we wanna start out low. We wanna start out the level of the bed. We're gonna go at about 3 to 4 inches. So just look at your catheter, put your finger about where you're gonna wanna stop, okay? And then you're gonna have your clamp up here. So we're gonna have them take slow, deep breaths. Have them relax, because that's gonna make it a lot easier to get it in. So we're going to just gently, and now the mannequins are a lot tighter, but your patients can be pretty tight too. So smoothly and gently just insert it like going towards his belly button, because we wanna go follow that path of the anatomy, 3 to 4 inches. So once it's in, I'm going to unclamp it, but you guys won't unclamp, because then we'll have a puddle in the bed. So leave it clamped, but just tell us you did it. Hold it there, because our bodies are gonna just wanna naturally try to push that back out, and they will. So just hold on to it, and I'm gonna take this from Christina, and I'm gonna slowly raise this to about 12 inches up off the bed, and then gravity will help pull that fluid in. If he starts cramping or having belly pains, or it's too much, I can slow it down by lowering it. If it's too much, I can lower it all the way and clamp it and let him rest for a little bit, and then try and get the rest in. So once it's all done, if you'll hold on to that for me, then I'm just gonna gently take this out. And I'm gonna get my wipe or my washcloth and just clean his bottom off. Get that lube off there. So then we're just going to get rid of this. I'm gonna put it back up there so I don't make a mess. And we're gonna let him come back and rest on those pads. And we want him to hold it for as long as he can. 15 minutes is usually pretty good, but the longer they can hold it, the better it's gonna work. If it's not that long and they can't hold it anymore and it's just gonna come on out, we just let them go. But the longer they can hold it, the better it'll work. And that's enemas. What questions do you guys have? It's not hard at all. I'm gonna bring this back over here. Get him covered up. And then we got plenty of enemas. All of the mannequins have holes that we can use for giving the enemas. They have rectums, so you can split up and go to the beds. If you go to this guy, just keep in mind he's really heavy. So I would maybe stick to partner up at these